It's an absolute living nightmare. We've gone from a lockdown to a shutdown.
Day on day, this gets worse and worse.
We just expect this to get a lot worse now as everything opens up.
We're running a business that
pressure building, businesses pinged into closure. Eventually, the government had to act. Supermarket depot workers in England will no longer have to quarantine to prevent stores from running dry on vital food supplies. Up to 500 test sites at key depots will be set up, so pinged by an app or contacted by NHS Test and Trace. If staff test negative, they can work regardless of if they've had a vaccination. So clarity at the checkouts. But for wholesalers like Country Range, who provide food for hospitals and care homes, not so much.
The government say that they've secured food supply for the nation. You must be over the moon.
No, they haven't done that at all.
During lockdown 1, wholesalers counted as key workers. Now, to exempt staff from isolating, an individual email needs to be sent to central government for each individual worker.
How practical is that for you as a business?
Completely impractical, because we don't know how long it'll be before we hear back. How long is it going to take for the government to come back to us? And every day counts. Every day we are feeding thousands of residents in care homes and hospices. So we need to know straight away if we can bring these staff back to work.
The week is ending very differently to how it started. On Monday, all legal restrictions in England lifted, so-called Freedom Day. Now, emergency measures with more than 618,000 people in self-isolation.
And there is evidence today that the economic damage is starting to spread. One closely watched survey of business sentiment recorded a sharp slowdown in the recovery in July, showing the weakest growth since March when restrictions started to lift. A big factor in that lost momentum, say business, is the number of staff forced to stay at home.
The government is trying to keep the recovery on track, listing 16 key industries that can apply for quarantine exemptions. Industries like transport, energy and other key infrastructure. But for vast swathes of the economy like hospitality, nothing.
Well, look, I accept that it's a narrow and quite limited exemption, and that's by intention. We don't want this to be a general approach that anybody can say they're critical. It's been deliberately drawn to be quite narrow, but we have taken a quite consciously different approach on the food sector.
In practice, say many in the 16 industries earmarked for help, what they actually have now is confusion.
It's incredibly vague. I mean, they haven't put out guidance, they put out a statement. The state guidance would require significant chapter number of what facilities are involved, what's actually involved, what procedures you have to follow, what bars do you have to, what hurdles you have to jump in order to be qualified for this. None of that is clear tonight. None of that is clear. And they really almost have to ignore what government is saying because they're not helping. They're just being confusing and actually not understanding the key pressures that businesses are under and therefore getting it kind of wrong in the way they communicate. And clarity is the key. In a crisis, you need clarity, you need grip. And there hasn't been a sense of that this week.
Come mid-August, the rules are set to change again. Isolation ditched for the vaccinated. Until then, government hopes this is a temporary problem to be bridged. Business is less convinced.
Well, COVID cases have been rising in almost every region of England. 1 in 75 people now have the virus, although the rate of increase does appear to be slowing down. Latest figures show another 36,000 new cases were recorded in the last 24 hours. Another 64 deaths, sadly, were reported. That's up 45% since the previous week. Just 43,000 people got their first COVID vaccine yesterday, while more than 174,000 people got their second jab. Well, Jane Deeth is in the newsroom with the latest for us now. Jane.
Yes, Friday is COVID Figures Day, and the headline today is that in the week to the 17th of July, more than 800,000 of us probably had COVID. That's a big rise on the week before, and in most cases, people caught the more infectious Delta variant. Public Health England is warning the increased risk of catching this variant applies even if you've had COVID before. So the latest estimates are that 1 in 75 people in England have COVID, up from 1 in 95 the week before. In Scotland, it's 1 in 80. In Northern Ireland, it's 1 in 170. And rates of the disease are lower in Wales, 1 in 210 people. These rates are similar to those we had back in February, but there is some hopeful news. The growth in infections has slowed a fraction, and the ONS graphs suggest it's just possible COVID cases could be starting to plateau in the northeast and the northwest of England. Another interesting detail in the graphs, in England and Scotland, it's people aged around 20 who are much more likely to get COVID, but this isn't the case in Wales or Northern Ireland. We also had a look at where the UK stands in relation to other countries now. Our COVID case rate can be expressed as 8,500 per 100,000 people. That's roughly on a par with France, but quite a few countries in Europe have higher rates than us, including Spain, Portugal, Belgium, the Netherlands and Sweden. And it's worth saying the COVID picture today is a reflection of infections 2 to 3 weeks ago, obviously well before Freedom Day in England on Monday.
Jane, thanks for that update. Well, the British Medical Association has warned that it's the government's COVID strategy that is causing rocketing case numbers. A little earlier, I spoke to the head of the British Medical Association Council, Dr. Chand Nagpal, and I began by asking him what he thought would happen to the number of cases in the coming days and weeks.
Well, clearly, if the figures were so high before restrictions were removed in terms of legal restrictions, we're likely to see a continuation of this escalation of spread of this infection in the community. Now, I think what's really important to say is that there's been a false narrative about the lifting of restrictions being in the interest of the economy, because what we're now seeing is thousands of people unable to work because they're getting infected and because they have to self-isolate. So we knew that this was predictable, that it was always the case that higher levels of circulation in the community would be bad for the economy, and why, in fact, this policy of allowing the infection to literally run loose in the community is not one that will serve the economy or serve businesses or employers.
OK, but the reality is we cannot be in lockdown forever. We've already had 3 lockdowns in this country. The vaccination level is now high. At some point, restrictions do have to be lifted.
Yeah, I think, again, it's a false narrative. No one's talking about lockdown. We're talking about simple measures of making sure that people don't spread infection when they're close to each other. We actually have the highest rates of hospitalization in a week in the whole world. 3 times as many hospitalizations than in France or Spain, and twice as many as in Spain. So, you know, this is affecting the health of people. So it's in everyone's interest to bring this infection down for the economy, for employers, and for society as a whole.
But thousands of workers are having to self-isolate, even though they don't have COVID, because they've been told they're in close contact or because they have been pinged by the app. That's also not a sustainable situation.
It's not sustainable because the government's lack of effective measures is resulting in a pandemic that's not being controlled within our nation. That's the problem. We don't have a pingdemic. We actually have an uncontrolled spread of infection of over 40,000 new reported cases a day, about 800,000 real cases over the last week, according to the ONS. That is the problem. And therefore, what you're finding is the app is working as it should. One of the biggest worries I have is that people are now going to stop using the app. And by stop using the app, they won't know that they're infected, and they will therefore spread infection even more. I think it's really important to say that I know it's a sunny day. I want to resume normality as much as anyone else. But the truth is, the UK is suffering levels of infection that is unseen in other comparative nations. And we have to take that seriously.
We are thankfully seeing a lower death rate. And not to undermine anybody who is dying with COVID, but we are seeing a much lower death rate than we were at this time last year. There is some good news, isn't there?
Of course, it's good news that we're seeing less serious illness and death. But again, we should not be complacent. Our death rates per million of the population is far higher than countries like France, Italy, and Germany. In terms of our hospitalization, these are people who are seriously ill, many of them younger people who are on ventilators. We're seeing figures, again, 2 to 3 times higher than other European nations. So it's not actually good news in terms of hospitalization.
What is the alternative? Do you want us to see a zero COVID strategy in the UK?
No, I mean, I think everyone is realistic that we are not going to get to any zero COVID strategy. But what you should not have is a strategy where you actually know that the infection will spread if people mix, and then tell people you don't need to be separating, you don't need to be wearing masks, but actually it'd be a good idea if you do. I mean, that's not clear public health messaging. So what I think we would have liked to have seen is the continuation of some clear public health requirements, which is when people go out and they're in a public transport, when they're in closed settings like shops, they should be protecting each other, and it should be a requirement. Already, we all know if we go to our own high streets, that's now already not happening. And as the days go by, more and more people will be spreading the infection, because we're going to be seeing, and we are seeing, a reduction in the numbers of people following basic infection control measures. So that is what we think should have happened, which is actually the case in all the other nations that have also seen increases in infection. No other nation has taken an approach to remove legal restrictions at a time when their infection rates are soaring. That seems to be not a very sensible public health measure.
Okay, Dr. Chung Nakpul, thank you very much for joining us.